salvageable is that hand, you think?
Neurosurgeon.
What was that? Did you get that?
No.
It's all right. We're gonna take good care of him.
Hey guys, Dr. Dan here. Welcome back to my channel. If you're new to my channel, I'm a practicing orthopedic spine surgeon, a dad, and here on YouTube, I love teaching medical concepts and also motivating all of you future doctors with medical drama reviews. The current crowd favorite is Grey's Anatomy. In the last 2 episodes, I actually reviewed the very intense plane crash episode, and I highly recommend you check those out before you watch this episode. This episode is going to be on the plane crash aftermath right after this. Before we get started, I just want to thank every single one of you guys for being here. There's been a lot of new subscribers recently, and I thank you all for supporting my channel. You guys are always leaving such nice comments, encouraging me to make these videos. Now, I'm going to ask you for one small favor. Smash that like button below to let YouTube know you love these videos. If you're new to my channel, hit the subscribe button and the bell notification so you don't miss any future Dr. Reacts videos. Let's get started. Just a quick recap on how the last episode ended is that Derek, Christina, Meredith, and a bunch of others were actually horrifically injured during this plane crash, and now they were waiting to be rescued. Let's see what happens in this episode.
I have to get on a plane.
Dr. Gray, you were on a plane. You were in a plane crash. Can you tell me what you...
Guys, that was such an intense episode, and to be honest, I am lucky because I get to jump around from episode to episode. I'm not really attached to any of these characters. I kind of started liking some of the characters because of the episodes you've had me watch, but I feel your pain. A lot of you guys are leaving very sad comments, and I get it. If you're a Grey's Anatomy fan and you've been watching from season 1 all the way to season 9, this will be hard for you to watch, so I feel your pain.
We're taking care of them.
Okay. Mama's here. There we go.
I'm so glad they did not kill off Meredith with her being a parent. You know, once you have children, your children are everything. Being a dad, I totally understand the relief that she feels here being reunited with her daughter.
Taking us home tomorrow on a plane. And I said no planes, but we don't have a choice because of Mark in Arizona. So I told Bailey to just sedate all of us. And we'll never know what happened.
Guys, so Mark in Arizona, something happened to them. Did they die? I hope you guys are not making me watch another episode where someone gets killed off. It was not nice of you guys in the last Doctor Reaction video. But here Meredith is saying that she asked them to sedate all of them. And she's asking them to give them certain medications that actually make them unaware of their surroundings. This is used in medical practice in different scenarios. So if I'm in the emergency room and I have to reduce a fracture or set someone's bone, that's a very painful procedure, so we'll administer a sedative to try to make the patient woozy before that happens. Or even when a patient gets an MRI and they may be claustrophobic and they have to go into one of those narrow tubes, then a sedative may be used to help them get through that experience. Arizona. Mark.
I wish they had put me out too.
How is it?
So thankfully, it looks like Mark and Arizona are still alive. I hope they do okay. Let's see what happens.
How is Arizona's infection? Is it getting any better?
Don't know, I haven't seen her.
What do you mean you're running her service?
What? You really think she wants to talk to me? Hey, remember the time that I quit and you got pissed and took my seat on a plane that crashed and now you're trading in your wheelie sneaks for peg leg?
So Meredith here says that you're running her service, and service is a term that's used in residency to basically describe your patient census of who you're responsible for. And so you might be running the vascular surgery service or the orthopedic service. And so Alex here is taking care of Arizona. He makes kind of an insensitive comment here. He says that she may have a peg leg or a fake leg or a prosthetic leg because she sustained an injury to her leg that may require an amputation. Now, just to recap from the last episode, she had sustained an open femur fracture, and the thigh bone had actually broken and poked out through the skin, which is a very serious injury. I hope she's okay. Let's see what happens.
You're talking to Sloan, right? Keeping him updated?
Yeah.
Not about work stuff, though. He doesn't need that kind of pressure right now.
What is wrong with you two?
Oh, I just said.
No, I'm just saying, they're fine. They're gonna be fine. Arizona's not gonna lose her leg, and Sloan is coming back. They're coming back.
So Meredith here is being very optimistic, which is good, but Alex and Avery are not so optimistic. And this is just a situation where doctors know too much. They're thinking about scenarios in their mind of former patients that did not do as well, and they're thinking about the worst case scenario. They're obviously worried, and these are patients that they are personally connected to, so it makes it worse.
She doesn't even belong on this floor. She is violent, uncommunicative, and I'm worried.
She communicated, she just hasn't talked yet.
Look, there is nothing physically wrong with her. She belongs up in psych.
I'm the chief of surgery and her husband. Don't tell me where she belongs.
Look, with all due respect, sir, that is exactly why you
So it looks like Christina here is experiencing an episode of psychosis, where someone loses touch with reality and they may be experiencing hallucinations or diluted thoughts, and they are just acting strange. And there's two causes of psychosis. There's primary psychosis, which is related to a psychiatric condition like schizophrenia or bipolar disorder, or secondary psychosis, which can be caused by a organic medical condition like a brain tumor, HIV, syphilis, or a stroke. And these are conditions that can actually be treated to reverse the psychosis. And here, this doctor is saying that there is nothing physically wrong with her, and so he must have completed a workup and tried to look for all these other secondary causes, and there was nothing. And so now he's saying that she belongs in the psych ward because this is a case of primary psychosis.
They're gonna take you upstairs, and they're gonna pump you full of antipsychotics. And you're gonna go slack-jawed and cuckoo's nest. And you'll never be you again. Christina, please, I am begging you, please. You have to say something. Do you hear me? Say something, please.
So antipsychotics are a class of medications that are used to treat psychosis. And these can be risperidol, lithium, Haldol. Meredith here says that you're going to go slack-jawed, which means the mouth is hanging open, that you'll never be the same if you take these medications. Antipsychotics are known to have some pretty significant side effects. They can make patients feel very sedated. They can't think as quickly as they'd like. They feel some rigidity in their muscles. Generally speaking, there's a lot of side effects. And so this is what Meredith is warning Christina about. At the same time, what's unrealistic here is that she's warning her that she's never going to be the same. And that's just not the case. A lot of instances where patients have an episode of psychosis, they go to the psych ward, they get treated, and they can be normal again. And if you didn't know, at the end of each episode series, I actually score each episode based on its realism and its entertainment. And here, unfortunately, I'm going to have to ding that realism score.
That in here, please. How salvageable is that hand, do you think?
I'm a surgeon.
What was that? Did you get that? No. It's all right. We're gonna take good care of you.
So just to recap, guys, in the last episode, Derek actually had his hand trapped in a piece of metal, and he actually used a rock to free his hand, causing his hand to become even more injured. And so here, before he gets put under anesthesia, he hears the surgeon asking, how salvageable is that hand? Which is, the surgeon is looking at the mangled hand, wondering if it can be saved at all. And he must be horrified being a surgeon. If I was under that scenario, he's trying to tell them, I'm a surgeon. I would be doing the same. Be like, please, 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 save my hands. You know, without my hands, you can't do anything as a surgeon. So that must be pretty terrifying. Hopefully it works out for him. Let's take a look at that x-ray that Derek was looking at. Now, just to review some hand anatomy, if you look at your hand, these long bones in your hands are actually your metacarpals. And these little smaller bones here are actually your phalanges. And you have a proximal, middle, and distal in these 4 digits here. In your thumb, you have 2 of them. And if you look at this x-ray, it's a little fuzzy, but I definitely see a fracture in the first metacarpal and as well as in the second metacarpal. And it looks like maybe in the proximal phalanx of the thumb as well.
There was damage to the second metacarpal, but the first MCP joint was completely crushed. So Boise did an X-fix. I revised it to an internal fixator, and then I removed a lot of scar tissue so there wouldn't be contractures.
So Dr. Torres here mentions that Boise put on a X-fix, which refers to an external fixator, which kind of looks like this for the hand. Now, external fixator uses pins, and it's a device that basically holds the fracture together, but it's outside of the skin. This is a temporary device until you can do a internal fixation. Now, Dr. Torres said internal fixator, but it's actually an internal fixation. And what that refers to is when someone actually makes an incision, gets down to the fracture, and puts plate and screws like this to actually fix the fracture. So Dr. Torres here mentions that she removed scar tissue to prevent contractures. And contractures are actually when joints get very stiff and rigid, and scar tissue can actually cause that. And scar tissue is this thick fibrous tissue that forms in areas where there was damaged tissue, and Dr. Torres is removing it to try to maintain Derek's range of motion in his hand.
Derek, it's the nerve damage that I'll concern myself with, and it looks like a pretty easy fix. You know, that'll get you your prehensile strength back, that'll get you this back.
Which will get me back into the OR.
But your hand was badly damaged. And I think conservatively, I can get you back to 80% function.
So this specialist that's speaking to Derek is totally correct in that nerve damage is permanent. And even in my clinic, I will tell my patients that, look, muscle can grow back, skin can grow back, bones can grow back, hair can grow back, but nerves may not grow back once they're injured. It can be a permanent injury, and this is what Derek's facing, which could be devastating for him. Now, the one thing that's very unrealistic here is that this doctor just pulls out a number out of the air. He says, the chances of me getting your nerve function back is 80%. And I don't know where he's getting that number from, and rarely do I just pull a specific number like that out unless you absolutely know for sure. Nerve damage is really unpredictable, and so right thing to say here is that we're going to do everything possible to fix your nerves and to repair them, but it's really unclear how your nerves are going to respond. I just wouldn't pull a number out of the air like that, like it's a guaranteed 80%.
This may never do another surgery.
Oh, don't talk like that.
We survived. Zola has both her parents.
I know.
That's enough.
Leave it to Derek Shephard to put a positive spin on this. And he's right here. He is looking at the positive of the situation, even though he may never operate again, which is so devastating. He's thinking about how his child still has their parents. This is something I personally work on too, to try to always look at the positives and always look at the blessings and all the good things in my life that are happening when it's so easy to fall into the negative and think negative thoughts. So I encourage all of you guys to have that kind of perspective too as well. Now, I know you guys are gonna hate me for this, but I'm gonna have to end this part right here. This episode is so dense, there's so much to cover. We still need to find out how Derek's surgery will go, to find out what happened to Arizona, what happens with Christina, and what happens with Mark. There's so many concepts here to cover, guys, and I want to be very thorough. So if you learned something from this episode, please smash that like button. Thank you so much for being here. And look, leave a comment. Let me know what episode you want me to react to. This is a democracy. I listen to every single comment of yours, and if you're sick of Grey's Anatomy, you let me know down there, and maybe we can switch it up. But right now, you guys all love Grey's Anatomy. Again, thank you so much for being here, and I'll see you on the next video.